Hey guys, it's me, Cupid. Um, I've decided to only do videos maybe a couple times a week from now on. Um, I have schizophrenia, by the way. Forgot to get that out of the way. So I wanted to talk today about dual diagnosis and comorbidity, especially with drugs and schizophrenia. I thought that would be an interesting topic. I also had someone request it. So hopefully you guys enjoy. So let's start with with some interesting stuff about substance abuse related to schizophrenia. So comorbid substance abuse disorders have emerged as one of the greatest obstacles to effective treatment of persons with schizophrenia. Estimates of the prevalence of such comorbidity vary, but as many as half of persons with schizophrenia may suffer from a comorbid drug or alcohol disorder. Younger age, male gender, and lower educational attainment are associated with greater risk for addiction. Persons with schizophrenia and comorbid addiction tend to have an earlier onset of schizophrenia than do those without comorbid addiction. Research does not support a link between specific symptoms of schizophrenia and choice of abused drugs. Rather, drug choice is correlated with the pattern of ambient drug use in the community. Comorbid substance abuse disorders are associated with a variety of poorer outcomes, including increased psychotic symptoms, poor treatment compliance, violence, housing instability, and homelessness, medical problems, poor money management, and the greater use of crisis-oriented services that result in higher costs of care. Sorry, my kitty's right here. You can see her little ear. So this co-occurrence has been a heavily debated topic for decades. Most researchers feel substances such as drugs and alcohol do not cause schizophrenia. Instead, people living with mental illness use substances as a coping mechanism. However, some researchers have also concluded that it could occur that the other way around and have found that substance abuse can increase the risk of developing schizophrenia. Sorry, I'm getting all caught up in my words. And my nose. I like to call it drooling, but I know that that's not for your nose. People with schizophrenia are up to 4 times more likely to be diagnosed with substance addiction compared to the general population. The co-occurrence of substance abuse and schizophrenia most often occurs with the mental illness coming first and the substance abuse coming second. Commonly, someone with schizophrenia begins using an addictive substance to deal with the symptoms of this condition. This is very dangerous because even moderate use of substances can exacerbate many of the symptoms of schizophrenia. Schizophrenia and addiction or substance use disorder often co-occur. In fact, an estimated 50% of individuals suffering from schizophrenia have a history of substance abuse. People with schizophrenia often engage in substance abuse as a way to self-medicate or alleviate feelings of anxiety and depression. The onset of the mental illness is often a very stressful time. There are many challenges, especially for people diagnosed with schizophrenia. If they lack the access to proper mental health treatment or education about the illness, they are at increased risk of coping with drugs and alcohol. Drug and alcohol use can also lead to an earlier presentation of psychotic symptoms, induce psychotic relapse, or increase symptom severity. Those who are diagnosed with schizophrenia often have a difficult time because the signs of schizophrenia are far more obvious than the substance abuse issues. So treatment for schizophrenia alone is often attempted first. However, it can take some time and dedication to get the medications just right, and many patients do not like how the meds make them feel and stop taking them while sabotaging their ability to succeed in treatment by continuing to drink or use drugs. It is important when both diagnoses are present that the patient gets help from a dual diagnosis treatment program to address both issues comprehensively at the same time. The mechanisms underlying the high comorbidity between substance use disorders and schizophrenia are poorly understood but are likely to include both common as well as drug-specific factors. The involvement of the brain dopaminergic pathways is likely to be a shared feature in this comorbidity that is common to all drugs of abuse. To start with, the mesolimbic dopamine pathway has been implicated not only in the rewarding mechanism for all drugs of abuse, but also in the occurrence of positive symptoms in schizophrenia. Thus, it is not surprising that drug intoxication, methamphetamine or marijuana use can trigger acute psychotic episodes, and that some drugs and methamphetamines have been used to create surrogate animal models of schizophrenia. On the other hand, the mesocortical DA pathway has been implicated in the neuroadaptations that result from repeated drug exposure and as a contributor to the negative symptoms of schizophrenia. Most antipsychotic medications block DA-D2 receptors, thus interfering with DA neurotransmission. Therefore, it is conceivable that schizophrenia patients may resort to drugs of abuse to temporarily compensate for the anhedonia induced by D2R blockade in the brain regions involved with reward, and or counteract the cognitive deficits that result from prefrontal D2R blockade. However, because chronic drug use is associated with a reduced DA neurotransmission, this behavior could actually backfire and exacerbate negative symptoms and cognitive deficits and interfere with functional recovery. The comorbidity of substance abuse and schizophrenia may also be a direct consequence of the underlying neuropathology of schizophrenia, which may contribute to the enhanced addiction vulnerability by disrupting the neural substrates and mediate positive reinforcement. One proposal is that the imbalance of hippocampal prefrontal regulation of DA release in the NACC may contribute to both psychosis and the vulnerability to drug abuse in schizophrenia. Non-DA pathways have been implicated too. For example, the cognitive impairments associated with prefrontal circuits also involve dysregulated glutamatergic neurotransmission, and for both disorders, medications that affect glutamatergic neurotransmissions are being evaluated as potential treatments. Nicotine is by far the most prevalent drug abused by schizophrenia patients. While this may be partly due to its legal status and easy access, it may also reflect nicotine's specific effects on the brain. Nicotine acetylcholine receptors. Okay, so the self-medication hypothesis suggests that smoking may alleviate some of the cognitive deficits commonly observed in schizophrenia. There may be a neural basis for the hypothesis. Specifically, it has been reported that individuals with schizophrenia have fewer and less functional low affinity and high affinity nicotine receptors. This might explain how smoking by schizophrenia patients could improve some of the cognitive deficits seen in this disorder. Post-mortem studies have also reported that the brains of schizophrenia patients have deficits in inhibitory neurons. Thus, the recent findings showing that nicotine upregulated the expression of glutamic acid decarboxylase gene, increasing amidobutyric acid synthesis in the brain, could be another pharmacological effect that contributes to comorbidity. Alright, so there's a lot of information I could go over. I could probably talk about this for a long time. I am going to, go into some information about myself. I did use drugs. I'm pretty sure I've talked about this before. I'm not not drinking at this time in my life, but I did use alcohol. I've used cocaine. I've used pills, ecstasy, prescription drugs. Obviously not my prescription drugs, but also my prescription drugs as well. Adderall, anxiety medicine, marijuana. I've done all kinds of things really, but you know, there's certain things that I didn't do, like heroin, and I tried meth maybe once or twice, didn't like it. I always thought that my mental health stuff, my schizophrenia, was due to doing drugs, but as I've read that it can be a cause in some cases. In some studies they prove that it can be a cause, but in other studies it proves that it's more of a, what do you call that, environmental trigger. So it's more of a trigger than it is the exact cause of the schizophrenia. So it can depend based on whatever study you read, but I don't know anymore whether it's that or, I mean, I had schizophrenia, I was diagnosed with it when I was a kid, so who knows? I could have already had it, obviously, and then that just was the trigger. It definitely started to appear when I started doing drugs, and I thought ending drugs would end the stuff, but it never did. So it is what it is, right? Anyways, I hope you guys enjoyed my video today. If there's anything that you guys want to talk about, whether it be your drug abuse, the things that you guys used, I don't know how you dealt with it. I went to NA, AA meetings, but the reason I stopped, the biggest reason I stopped was because I started having major symptoms. I started having heart issues, and I didn't know, you know, I ended up doing some crazy stuff because of, you know, the drugs and stuff like that, and I think I didn't know what was going on, and I realized that I didn't want to go down that path, and so I stopped. You know, I've relapsed a couple of times, but for the most part, I have been pretty good since then. So, you know, if you guys have any stories about your substance abuse, what kind of drugs you used, what you did to get over it, please leave a comment down below. Would love to hear you guys' stories. Substance abuse is a very difficult thing to get past. So if you guys need someone to talk to, I'm always here. But I also recommend getting in touch with someone who is a professional and getting the help that you need as well. It's a serious thing. It's a very serious thing. So if you're dealing with it, I definitely recommend getting some help. If you guys have anything you want me to talk about in a future video, let me know in the comments down below. I'm going to start trying to make my videos a little bit more fun, a little bit more active, and maybe give some more things for you guys to interact with. Anyways, I hope you guys are having a wonderful, beautiful day. Stay wonderful, stay amazing, stay awesome, stay unique, stay you, and above all else, love yourselves. Okay, guys? Peace and love.